The program is so new, a paper sign still marks the entrance at one location. Inside, this is where people who struggle with substance abuse can begin to turn their lives around.
It's really a great program in terms of providing resources.
Using $45 million in federal funds, the state formed 9 locations called Doorways. The goal, addiction help is less than an hour away for every Granite Stater. In Lebanon, Dartmouth-Hitchcock Medical Center operates one of them.
Many are looking to start treatment, many are looking for detox services, there's housing questions.
People can access the Doorways by either showing up in person or a simple phone call to 211, which connects you to resources.
60% are people calling for themselves, and about 40% are people calling for family members or friends.
Thank you for calling 211. This is Paula. May I have your zip code and age, please?
A call to 211 is confidential. It's been around for 10 years.
If you're not ready yet for that live connection, it's still a great place to call. We can connect you to something, to some resource that may put you on that path to being ready to call the Doorway or for a live transfer to a clinician.
In the first 2 months of the Doorway program, 211 received 13,000 calls, of which about 600 were substance abuse related. On average, 4 or 5 specialists work the phones 24 hours a day, 7 days a week.
Thank you. And how can I help you?
Would talk to them a little bit about what they were looking for, where they were at in that process, and then offer them ultimately a warm handoff, a nice live connection to one of the hubs that would be suited best for the caller.
If someone calls 211 overnight while the Doorways are closed, a Dartmouth-Hitchcock clinician will either schedule a next available appointment at the closest location or find them immediate resources. Dartmouth handled 90 after-hour calls in January and February.
If it is an emergency, we may recommend going to the emergency room, but we also know that that's not the best place for many people to be, and definitely not for ongoing services.
For those crisis situations, safe stations are still seeing high numbers. 24/7, people can find addiction help at Manchester and Nashua fire stations.
For this hub, we're kind of the front door. So I think everybody that is getting to the hub and going to hub services in Manchester generally come through the fire department.
The Manchester fire chief says they're still seeing more than 200 people a month.
You know, I look at 211 and, you know, Safe Station is kind of the same thing. It's an access point to services.
Services that are expanding in New Hampshire, opening more doors to care.
No door is the wrong door. Really, we're just trying to improve and make the access easier for people.
Mike Cronin, WMUR News 9.